Hi there. I'm covering an emergency pharmacist locum cover today in one of the community pharmacies. So I've just arrived in the parking area. I'm going to the pharmacy. I'll show you what we do as pharmacists to start the shift and what are the necessary and mandatory requirements. Stay tuned. Good evening and welcome to Pharmacist Live with E.R. Faruqi. Today I'm covering a locum pharmacist shift here in a late night pharmacy, and I would like to share with you what does a local pharmacist do and how do they work in pharmacy to pharmacy, obviously where they haven't worked before, and what things they need to do when they come on a shift, and obviously how to work. So I would like to begin by saying that we start with two legal things that we first do as soon as we come to pharmacy and take the charge and become RP, which is responsible pharmacist. What we do is we print our certificate of registration, which is called an RP certificate, issued by the General Pharmaceutical Council. And if you don't have a certificate, you can always go to pharmacyregulation.org website, print it out, responsible pharmacist note, and put it up there. So I'll show you in a minute and where do we put it. And once you've done that, and you log into our online register or a manual register, depending on where you're working. This pharmacy has an online register of entry where all the pharmacists put their details, their name, their registration number, and the time they take the responsibility of becoming an RP. And once they leave, obviously when the shift is over, it's their job to make sure that they log out and sign out in the electronic book or the manual book is available to say that the responsible pharmacist is leaving and ceasing the obviously leaving the premises. Obviously once you've done these two things, then you're held legally responsible, and then the pharmacy staff would obviously give you a control drug key, and in some pharmacies, ideally in most, obviously there should be a control drug log, and where you have to sign the log upon receiving the CD key and the time they receive CD key, and the CD key should be received in a sealed bag, taped top, wrapped and signed by the other pharmacists who last worked on a previous day or earlier during the day in the shift. Once you finish the shift, obviously it's your job to make sure that the CD key is returned, the log is signed at the time you returned it, and also sealed in a bag, obviously initialed by yourself with the date and when you leave. This is the opening and closing of pharmacy. Obviously you log out of the pharmacist as well. In addition to that, and then obviously there are some other things that I want to discuss with you today. On the back, you see behind me, it's a consultation room. So I'll take you to consultation room and show you what is required for a consultation room to have, and what sort of consultation that we need to do as pharmacists, and why do we use consultation room. And in addition to accuracy checking that we do here, and we also provide medicine use service, new medicine service, weight management program, smoking cessation service, and other CPCS referrals that we receive from out of hours GP, and also CPCS service, emergency contraception, and the list goes on and on and on, depending on which pharmacy you're working. And obviously during flu seasons, pharmacists are also doing flu vaccinations to patients. Obviously they have to book it online and make an appointment before that. Repeat prescriptions. There's a lot of services that pharmacists do in community pharmacy, and late night pharmacy is also in addition to the services. Obviously, a lot of customers or patients come in for minor ailments, and pharmacists are here to provide advice relating to minor ailments. And there are some obviously pharmacists that are trained to provide ailment to these minor conditions. And behind me here, over there are two shelves, over the counter and a pharmacy only. And a lot of pharmacy only medication are also kept in the pharmacy on the back section. They are called P medications. So when patients sometimes request a P medicine, as a pharmacist, it's our job to make sure to see the need if the patient really needs it, and then if we can give it out to patients. For example, cyclizine and sickness medication is a P medication. It's up to the discretion of pharmacists to be able to decide if the patient needs it. They can give it out on prescription, similar to if somebody is anemic and they need ferrous sulfate, they can give out the pharmacy medication. They don't need a necessarily prescription for it. In addition to the over-the-counter medication which they can buy from shelf and they don't need pharmacist, the involvement of pharmacists in there. Regarding pain medication, for example, painkillers, codeine is widely used as a painkiller and is classed as pain medicine for the pharmacist. A pharmacist's involvement is necessary in selling of pain medications, and the different formulation that comes with codeine, paracetamol, caffeine, they all come in a different combination with different brands, so the pharmacist would be able to advise you on obviously what indication they're using it for short term, and obviously whether or not they're taking any additional painkillers with it. For example, paracetamol, not to be taken along with any paracetamol codeine containing preparation. Obviously codeine causes drowsiness. All these sort of counselling that needs to be given when we sell the cocodamol, for example, codeine paracetamol combination drugs. Also make sure that it's given to a population where they understand it causes constipation and also addiction if used in a long term. So I'm going to show you the consultation. So this is the pharmacy where I was standing, and I was talking about this RP certificate, which is a responsible pharmacist certificate, and it's this. It's my name, my registration number, certificate. So once you put it on, obviously you're responsible. This is the prescription charge here in England, £9.15. And I'll take you to the consultation room. This is the consultation room. It's vacant, and we'll see what we do in consultation room. So it's a bit messy at the moment. This is the consultation room. So what we do is, this is the bedside, obviously, if you want to take blood pressure, lying down, sitting down, different position. If patient's unwell and you want to do minor ailment assessment, the bed can be used. And if you don't want to use bed for a chat, we can use this table and a chair, so you can have a consultation, private chat about emergency contraception, medicines use review, and also flu vaccination, new medicine service, smoking cessation, weight management. So we've got the weight, you can see under here, and we also have the height measurement for somebody's BMI if you want to calculate. And this is it about the consultation room. So yes, some file folder there. A lot of things can be done in consultation rooms, and the pharmacists are in this country classed as clinicians because of that, because their involvement is not just about the supply of medicines, but also it goes beyond that. It goes with a patient's involvement, patient's health management, and also clinical decision making about their health. So that's it. Over here we have shelves behind the counter, and we see on the left hand side all painkillers. Obviously half shelves empty because they're running out, and a lot of people are buying over the counter from pharmacists because of a possible lockdown, national lockdown, and that's probably why a lot of painkillers are gone. On the bottom here, painkillers, basically cream ointments and stuff. Mostly I would say all P medicines. The pharmacist only over here, cough, flu and cold, and obviously going down here we've got ENT item and pediatrics painkillers again, and that's the GI section. You see over here the fungal creams as well, and allergy section, and over here a lot of nasal sprays as well. So this is the over-the-counter section. Right guys, for online verification of prescriptions to be sent to Hub, this pharmacy uses this accuracy and clinical checking of prescriptions. On the left, which is obviously covered, are the patient's name with their details in NHS numbers, and obviously I have an option to select the patient and then do the checks. So I can either do accuracy checking, clinical checking, or both. And as a pharmacist, what we do is we click on both checks, select the patient. You can see on the right side the status, all the patients completed, only one left. So I'm going to just show you quickly how we do this. So I've selected that patient, I'm going to do both checks, and then what we do next, I'll show you the windows. As a pharmacist, that's what we do, accuracy check and also clinical check, and then the prescription goes to the hub for dispensing. Once it's dispensed, obviously they match the details from the prescription and give it to the patient. So basically afterwards there is no involvement of pharmacists, any checks obviously on prescription items. Let me show you the next tab. It brings me both tabs. It brings me accuracy checking window first. So I'm accuracy checking the prescription. That means the drugs, amlodipine 10 milligrams, obviously I've covered the patient details and their confidential numbers and the surgery details, so basically to be on the safe side data confidentiality wise. Amlodipine 10, obviously dose is correct. I've also checked torstatin dose correct, and obviously there's no interaction between them like glutide. Okay, once a week increased to 1.2, alright. And the metformin dose is also correct. So I've clicked on this, I've verified accuracy checking via all these stroke. I'm going to do page down, and there's another ramipril. So once I've done accuracy checking, it gives me option of page up. See if I've not ticked any of those. I've missed out this. So page down, and now this is accuracy checking complete. So when I do this, it brings me to a window where I can do the clinical checking of prescription. So over here we have a summary of previous medication and the dates. Obviously this prescription has been prescribed to the patient earlier. Last month, for example, she had, well, this is this month. So this is, all these medications are new, and the other, as you can see, the mobile cassettes and the rinse are given. And if I'm happy with all these 4 medications, obviously the details are hiding because of I'm hiding patient details really. So yeah, so if I'm happy with these and there's no interaction and there's no contraindications, doses are all safe to give, I'll click on clinical check complete. So over here, this is the reception area where we, talk to patients. If confidential chat is required, then obviously we take them to the consultation room, and obviously payment, prescription given out, the counter over here. And here, this is what we're saying, the folders of services we provide in this branch. Medicine use review, new medicine service, CPCS, weight management, media service, end of month, other miscellaneous service. That means flu vaccination, smoke cessation, etc., etc. Over here, folders for minor ailment, emergency hormonal contraception, etc., etc. Over here, these are prescriptions and bags, and this prescription needs checking, accuracy checking, which means I'd have to check the product against the prescription. Quantity, interaction, it is appropriately prescribed, anything new that there may be, may not be appropriate for that patient. And over here we have creams and ointment, and inhalers, tablets, liquid shelf, and sink to make up liquids and stuff, wash our hands, and obviously all these tablet sections. So it's not it's not the biggest pharmacy, but obviously it's in the superstore, so it's fairly busy. So over here we have clinical waste, confidential waste bin, controlled drug cupboard. It has to be locked up at all times, and a fridge. So we'd have to monitor the fridge temperature every day and put it in the log. I think at least once every day. And the CD cupboard for Schedule 2 and Schedule 3 with safe custody requirement are kept in this cupboard. The main intranet page. So when we start our shift, we go open the main page and log ourselves in over here. You see this, responsible pharmacist sign out and sign in. And this is where we print our certificates. This takes us to the link where we fill our details, the name and registration number. And the certificate I've showed you outside, that's where it gets printed. And obviously other services we can report it online over here. Okay. And for CPCS referrals from out of hours and request of repeat prescriptions over here. Okay. Thanks for watching the video, and I hope that you found this session informative. Take-home message of the day would be: pharmacists are known as medication experts, so we should build our knowledge to a level where where we needed to advise, give information about medication to patients. We should know what we're doing. For example, there are lots of medication over the counter that pharmacists sell. Obviously, it's good to take patient history and ask relevant questions relating to past medical history if they had it before. For example, I've done a session on NSAID selling. So a lot of people come about anti-inflammatory, ibuprofen, and want to buy stuff. So it's good to know whether or not there are any other anticoagulants, any antidepressive medication or SSRIs. Obviously they can induce bleeding risks, and it's good to know if they have previous ulcers, and if if they've taken this medication before, what dose to be taken, etc., etc., etc. I've done a session and said, so please watch that video. In addition to the other ones, Katie has just stole a lot of money from the till, and she's bye Katie. Yeah. So in addition to codeine as well, obviously causes addiction. So signs like where people are over and over again coming to buy over-the-counter medication containing codeine, that means potentially they are misusing it. So it's good to counsel the patients and speak to them about it. If there's something chronic, obviously they can speak to the doctor about it. Obviously, because these medication can cause addiction in addition to long-term chronic constipation-related issues, and also drowsiness if you're driving. So that would affect your day-to-day life. So I think that's it for today, and do leave a comment if you like the video, and let us know how do you think, and hopefully upload more videos relating to pharmacy practice. Thanks for watching again. Goodbye. Catch you later.